Okay, moving on, we now have Ira Drucks. And one topics that you get cast in a lot is what can you need to know about Medicare, Social Security as people approach age 65. This is what Ira does, is to talk about what we need to know about Medicare and Social Security.
Okay, well said. There's a hard act follows. Very specific, but very well. She went another round of people. Yeah, this is a topic which I'm sure nobody wants to talk about. What happens when we turn 65? What happens when we get old? So being I'm old myself, so I figured I'm going to deal with old people, so I'm going to deal with Medicare. Now, one thing you got to know about Medicare, the government is not going to remind you when you turn 65 that you have to enroll in Medicare. You have to do it yourself. Normally, your employer's not going to tell you, government's not going to tell you. So if you turn 65, there's certain things you have to do. And hopefully, I can answer some of those questions for you. So, what do you do when you sign up for Medicare? There's three ways in which you could sign up. You have an initial period, so that's when you turn 65. That's when you're going to be signing up to Medicare A and B. There's your hospital pays are on there. The second one is general enrollment period, and that's what happens if you forget to enroll in Medicare. And now it's 6 months later or a year later, and they say, well, I've never enrolled in Medicare. Now they're like, well, so the problem is, if you enrolls under the general enrollment, you can only enroll in January of the next year, and your policy won't be effective until July, and you'll get a penalty equalize. So because you missed the third way you can enroll, this is a special enrollment period where if you're still working, you're over 65, and now as they're saying, tyrant has accepted it, and you're coming off the brew. That gives you an opportunity to roll at that time without a penalty as long as you do things correctly. So those are the new ways in which you involve. Now, how do you involve? There's a couple of ways. Into your collecting Social Security, which you eligible to collect at 62. Once you turn 65, you will automatically get a Medicare card. You don't have to do anything. Now, if you're still working and you get a Medicare card that says A and B, but you have to pay for your Part B, you could go back to Social Security and say, oh, I'm working for an employer and I don't need my Part B. They will take it off. They won't charge you. And when it comes time to retire, you get your Part B back. So you're not locked in just because you're collecting Social Security. So that's one way in which you could do that. Now, how do you sign up to Medicare? There's a couple of different ways. You can go to your Social Security's office to make an appointment. They're both to a JEPA within 2 or 3 months. But when you're signing up for Social Security, you have 3 months prior to your birthday. Now, if the birthday is, let's say, May 2nd or May 3rd, your insurance is always going to be effective the first of the month you turn 65. Every day first. So 3 months prior, that's when you would start your enrollment to Medicare Daily League. Now, those who are lucky enough to have their birthday on the first of the month, May 1st, your Medicare is basically going to start April. That's the only kind that you'll have the Medicare prior to the month in which you turn 65. Now, the way to sign up is you could schedule the complaint with the Social Security office, which I don't recommend because it takes you months sometimes to make a appointment. Or go on to Medicare.gov or SSA.gov and look up category all the Medicare. It's an easy process. When you go on there, it will say everything all in Medicare. You get enrolled in Medicare. Then we'll say sign up for Medicare. You sign up for Medicare. Then it will say you have a Social Security account. Wrongly at that point you don't. So you have to sign up for a Social Security account. So you sign up for the account. They're going to ask for a verification code. You sign up for your code. Then you log in. Then you're going to say you signed in again. put your password in again. They'll give you another code to put in. So this will go on for about 2 or 3 times until you finally get into the Medicare application. Now, if you get a question that says, "Are you blind?" We're in the run spot. And long I recognize as you're going to say, no. So that's how you sign up to Medicare. That will be 3 months prior. Now, forget, and you signed up on the month return 65, let's say in May, and you signed up in May 3rd or May 5th, the Medicare is going to start to file the month. If you missed that month and you sign up 1 month after that, it might be 2 months before the Medicare gets checked in. So at 3 months prior, the month you turn 65, and 3 months after, that you can sign up for Medicare without any penalties whatsoever. This is what your Medicare card will look like. That white little card. You can see your Medicare number is random numbers and letters. When you sign up to Medicare, you're going to get an authorization code that is not your Medicare number. So don't think that that's what you have to wait until you get your Medicare card, and that would give you what that number is. Used to be your Social Security number, but they changed it. Now, if you don't get your card, within 3 or 4 weeks, you can always go back to your broker and look for a verification letter, and that will tell you that your Medicare is now effective at May 1st. You'll give you the Medicare number. It will tell you how much your Medicare costs will be. So that's a little issue beyond that. Now, what does Medicare cover? Well, you have Part A, which is your hospital, or use your doctor. Now, if you don't have any other coverage whatsoever, you're only sitting with Medicare because you think, well, I'll have Medicare. I don't need any other coverage. Well, there are some deductibles and co-insurance. For 2026, you can see we've got deductibles, we have co-insurance, we have out-of-pocket. This is for 2026. Each year, those deductibles and those co-insurances will go up. So this is part there. Now, there's another Part B. Part B is your doctor. Normally, you have what they call a Part B deductible. That's $280 a Part B deductible, or you covered by X-rays and whatever the doctors will perform. So A is your hospital, and B is your doctor. That's what some people is. These will be. Now, here's an important thing. A lot of people, they're going to get into a situation where they're going to get their charge for a fee and then saying, oh, this is not so bad. That 2 months later, all of a sudden, because they're in the higher income bracket from 2 years prior, they're going to get a buy for $800 or $1,000 bill. They're going to say, what's all this about? Well, it's all based on what their income was 2 years prior. So this is kind of a chart to show you what your increase will be when you start your Medicare. Now, what I've done is I put this onto a different sheet, which makes it a little bit easier. So you have for your camera, I don't know if we have any of these handouts, but you have the end, take a picture of this, and this will show you. This is an example of what your charges are going to be, which are called thermal charges. Now, once you got to be realized, chance my slide there, you would see that you do have a Part B. You don't sign up for Part B unless you're supposed to. And I was telling you before you get a penalty, that is a penalty for life. The 10% penalty is you'll have that for forever. So that means sure that you sign up on them you're supposed to. On the on Part D, which is your prescription file, Medicare has nothing to do with prescriptions. You can buy prescriptions through Medicare. You have any full prescription, but you have a high income and they're going to charge you on counter charge because of your income. They're also going to charge you a parent charge on your prescriptions. Now, why do you do this? Because they can. That's the government book. Now, when you're taking a look at this, you would see that it is based on your 2000, this is 2026 or 2000 as a 1-4 income. So let's say you have high income in 2024, and then you retired in 2005, and your income has dropped, but they're now charging you back from 2 years ago. So you have 60 days from the day you get that letter to appeal it. So your income is going to be dropped in 2025, or even in 2026. We're only not even halfway through, but their income will cause you to get into a lower bracket. You could appeal that letter within the 60 days. If they feel that that is a justified change, they will lower your charge. Now, let's say you're saying in 2026 your income's lower. Well, and they accept that. At the end of the year, if your income happened to be higher, they're going to charge you. They're going to back charge. Another instance with the reason why we could do an appeal is, let's say in 2025, you're getting a big inheritance. Well, that's going to be part of your recharge. Or you sell a house or you sell the business. So you have a big income that year. You put an appeal to say that was only a one-time deal. You got a big severance package, you sold the house, you sold business, they will reduce it. You're not locked into that premium. It'll give you time to do it. You don't do it in 60 days, you're done for the year. So just keep tracking from the date that it received that. Now this is the letter that we get to receive. Shows you both the 6th date. There's a form that you pull down from Medicare. You fill it out, submit it, and this doesn't hurt to try. And then you have an opportunity to save some money, give it a try. All they can do is save that. Suck up. Okay. Go here. What is skull? That. Let's kick that. If you don't get your A and B, what you don't, there's certain things you don't have to get. Hospital and docs. There's no vision, there's no dental, there's no prescription, there's no beer, there's none of that. That will be due by a supplement policy, and I'll get into a minute. Sometimes the lands under that stuff. But your basic A and B is only hospital and your doc. You don't have anything else then. So like I said, you don't have prescription. Have to get a prescription from another area. Now, like you delay your Part D, okay, now here's something you should know. If you're working for an employer, then the employer has less than 20 employees, Medicare is primary. If you work for an employer, 20 employees or more, group is primary. Now, in years past, those who are a little bit older who surefine in the Cross or on the ETA, and you put in a claim and you work for an employee under 20 employees, normally the insurance company was paid a claim. I retired from Root Cross, and now at least 8 years ago, all of the claims were done manually. Now, of course, all the insurance companies do have a trial. So when somebody has a claim that's been put in, and it automatically scans for those employees who are under 20 employees, it's automatically going to go to Medicare. And I get a lot of calls that say, gee, why didn't my insurance company pay? Medicare is primary. Well, I'll talk that. Now I got to try to roll them into a Medicare supplemental advantage and try to make sure that they're covered. So it's very careful. You work for a group under 20 employees, you turn 65, you get to Medicare A and D. You're working for an employer over 20 employees, income made only. It's great. To sign up to that, and later on you get your Part 2 when that again you know that. Now, what can you do? Where do you go? There's a couple of choices. You could have work for an employer, you have the employee benefits. Let's say you're retired. How about you use a retired teacher? I'm covered, 100%. Under my wife's teacher's insurance. And as long as she's alive, I still have insurance, so I keep her alive. Now, You can go to supplement, so it's that is the moment, or you could go in as bench. Those are the three ways. Now, if you do working for a large company and they have to retire and benefit, we got to make a comparison. What is the employer's retirement benefit compared to a Medicare supplement or Medicare Advantage? And that's, really retirement. When you look at your retirement benefits, you want to just make sure that has all the things that you normally would have. Does it have the drug plan? Does it have all the deductibles in the phone insurance they speak? You really want to take a look at the retirement group insurance first before you want to do anything else. Now, when I'm talking about Medicare Advantage and Medicare Supplement, these are your options. You turn 65, you get Medicare A and D, and you now have the Medicare card. Now, there's two ways to go this. First is the Medicare Advantage. This is what's being advertised on television every 5 minutes. Because what you're doing is, if you go to Medicare Advantage, which means you're paying for your Medicare Part B, but you're giving up all your medicals. You no longer have Medicare. You now have what they call a Medicare Advantage. You're going to an insurance company like Horizon, Aetna, Humana, whoever it might be, and you're buying an insurance policy through that. All your claims will go through that. A Medicare Advantage will have deductibles, will have co-insurance, will have a network. You have to go to the in-network doctors when you go to a Medicare Advantage. Profit will be very similar to your group insurance. Now you could buy a regular Medicare Advantage or you could buy a PPO. The difference is if you buy regular, insurance through your Advantage, it's in-network going. A PPO, people think, oh, PPO, I can go to any doctor I want. Well, that's true, but not really true. Because if you do go to an outside doctor with PPO, that doctor has to accept what the HMOs don't give us. So you got to be careful. There's a lot of times where we can't go anywhere. That is a Medicare Advantage. The only advantage to the advantage, it has prescription. That's part of the plan. So you have the health insurance, all through before you walk through the insurance company, and you have a prescription. Now let's say the premium normally is zero. It's a zero monthly premium. The question is, well, how could it be zero and you're being covered by the insurance carrier? The insurance carrier tips between $600 and $800 a month, every month, for every person that buys an Advantage. So you can see the insurance companies make out very well. So you take $600 or $800 times 100,000 people. That's a lot of money for them to administer their plan. Medicare likes it because if there's $1 million claim, it's up to the insurance company, not up to Medicare. So now your option two is you have your Medicare A and D. Now you want to decide to go with the Medicare Supplement. Medicare Supplement, that's pretty intuitive. At age 65, it'd probably be about $185 a month. Now, what is the Medicare Supplement or Medigap, however you might call it? Medicare is going to pay 80%, your A and your B. That has the deductibles, that has co-insurance. And you buy a Medicare Supplement, you're only going to pay the $283 Part B deductible. After that, it's 100%. So if you decide that you want to go to Texas to have heart surgery, you go to Texas and don't go to pay that $282 Part B deductible. 100%. The only thing is, doesn't have prescriptions. You have to get your prescription from another carrier. Now, you can say, well, I don't want to pay a premium for my premium. I'll take the Advantage. Well, take the Advantage, and you can keep it for 12 months. Within the first 12 months, you could switch and it will go to a supplement. Now you take the supplement and keep the supplement. You can't go to the Advantage until open enrollment. Open enrollments from October 15th through December 7th of every year. So you do have, say, an Advantage, and you want to go to a supplement. The only way you could do it is to answer valuable questions. There's no open enrollment for a Medicare supplement. But you'd have the Medicare supplement for, say, 4 or 5 years. Your premium is going up every year. Now you want to say, gee, is there anything better as the heart? Oh, yeah. Go out, compare some of the rates from the other carrier. The premium's a little bit lower, and you can answer the medical questions. I haven't been in a hospital. I'm not a diabetic. To answer all the questions, no, you get covered. A few months ago, I had a husband and wife that were in their 80s. They didn't take any medication. They were in good health. I saved them each about $85 a month. That's $160 a month. And they could change many facts. You can 10 facts a year. But if you have the advantage, that only way should be at the supplements. You welcome a supplement to the advantage without any the questions during that little period of time. And it's a little confusing, but that's the way it works. Okay. Yes. Okay. The Medicare supplement, they have many different plans themselves. They used to have certain members plans now. Anybody over that? Plan that cover you at 100%. But the government said that, they need a little skin in the game. So we take that thing out with plan two. That's where the story today, $5 What's the larger from plans? They have plans from A through N or whatever it is. Globally, you got Plan G, which has that deductible. If you go to Plan D or Plan N, that plan is the same as Plan G, except have $20 or you could say $20 or $30 a month. So, or so. So we're looking at the plans. You done a video, what is the best way? So you use of travel, you have income, you should go sub. If you have a limited income, like a parent or somebody who lives on Social Security, they're not going to be able to have the Medicare supplement, and they would be very happy with the Medicare Advance. That's the right policy for somebody who has income. So you got to be careful. As long as the cost of the Medicare supplement and prescription doesn't affect your lifestyle but comes to tire, that's the way you should go, as long as you cost them the check. I could say that you keep a Medicare supplement for 8 or 10 years, and then all of a sudden your income is much lower, and you'll have limited income. Well, during that whole moment from October 15th to December 7th, you can go to a Medicare Advantage and pay 0 You should be okay. Quick question. Yes. If you're traveling overseas, does Medicare still cover you? You have Medicare has a tip. If you have Medicare supplement, has a 50,000 lifetime Medicare cover, $50,000. So you're overseas and you have a claim. What you do is you have to pay the claim when you come back and submit to Medicare. Or you submit it to you a supplement. Medicare itself doesn't have to know overseas, but the Medicare supplement will give you $50,000 like that. Well, I always recommend with doing any traveling overseas or any insurance, buy travel insurance. Interesting that. All right, so now basically the last part of this prescription part. What do you do with cost prescription drugs? Brokers used to be able to help you with it, choosing your prescription, but the insurance company did away with both broker supports. So now you're either out. So I could turn 65, or when you get your group insurance, when you leak your group, you have to go onto Medicare.gov and you go on your prescriptions and you'll lock in. And then we could know your prescription, your name, dosage, how long you take it. Then you choose your pharmacy. And then what it will do is it will list about maybe 10 to 15 prescription plates. Yes, ma'am.
Great presentation. I'm also in the Medicare state, but I just want to clarify that can enter the formularies and sign up for for because you're from the
Say that again.
you can enter formulary to assist clients elders and people on Medicare to sign up for such a drug plan. You don't have to go to the portal for Medicare. You can do it through the camera. What was your point?
Well, here, you do it through the carrier. So what's happening here is the carriers no longer paying the commissioners up the system. You could do that. Whether you can find a broker that's not a county, that's the question. But what I always tell everybody is to go on to the Medicare.com and put every year from October 15th to December 7th is an open enrollment period. So let's just say XYZ company the this year. And of course you do $5 a month. Now it comes to the end of the year and you don't go into the portal because you're happy with $5 a month. And you figure, well, I'll just continue with that second program. Now January the 1st coming along, and what they changing your opinion from $5 to $4. Now you want to say, gee, I don't have things my perfect, what's too late, and now I'm up for years. So they go into this portal between October 5th and December 7th, and putting for the restrictions, you can see ABC company went from $4 to $30. What does that company down to $8? Then you switch company. So every year, there's an opportunity to compare which company they want. That they put your prescriptions in at the beginning when you turn 65. And during the year, you increase 3 or 4 different prescriptions. When you go into that portal, she will say, update my prescription, and it was automatically added, make it within the year. Then you could edit and go for months, you will have the data. But it will automatically update that progress. But you gotta be careful, you got to do it, yes sir.
Once you missed that January 1st, I had that situation. And my premium went up $30 to $100. There's no way changing it during the year.
Too late. You gotta do it between October 15th and December 6th. That's the open road restriction. So do, which you have Medicare, make sure that you do that. October 15th to December 7th. Medicare.gov, go in your prescriptions, update your prescriptions, choose your pharmacy. Whichever plan you see listed here, normally it's the number one program, not the number one charity down for the bet. But we're going to take a look at what the premium is and what the annual outlay is. Sometimes the second one will have the lower annual outlay for a higher premium. For Medicare. So,
Yours are great.